I'm Dr. Ospina. I started in medicine at the age of 18. I'm a traditional trained doctor. I'm a family physician. After the internships, residency, getting into family medicine, I started to notice that medicine was failing to patients in some degree, and not because of the technology or the medications or the great advancements that we have done in the past 100 years, but because we kind of lost our way and we stopped listening and we stopped taking care of people and we stopped actually paying attention to what was happening to the patients. So I had a pretty bad experience during COVID. I was in ICU. I worked in ICU during the pandemic as a first responder. I was in emergency room and ICU, and I started seeing all these patients chronically ill, really bad, and dying from COVID. It was unexpected. It took us for surprise. Nobody knew what was happening. And I was in the ICU and I had 60 patients for myself. And at that point, we had the different medical teams, the specialists in ICU, internal medicine, family medicine, everybody. We had to decide who was going to live and who was going to die because we didn't have enough resources for everybody. We didn't have enough ventilators or medications or oxygen. It was a really bad situation. I never been in a war, but I think that's the closest thing to that. And I noticed that 70%, 80% of the patients that I was attending had chronic conditions, high blood pressure, diabetes, cardiovascular issues, obese, all of those things. And it was like, what are we doing here? These people, and by the way, those were the risk factors of COVID, because the more sick you were, the harder it hits you. I was like, what are we doing here? These people it's here in the ICU dying, and we have to decide who's going to live and who's going to die. But 10 years ago, we could make better decisions for them, and they wouldn't be here because we would control their blood pressure better. We would control their diabetes. We would control or prevent even bad from happening. And what are we doing here? This is not medicine. This is not medicine. I mean, we're saving lives and that's cool and all that and great and good job, doctor. But it was hundreds of people, and I had friends. I lost friends as well, doctors, colleagues, and all of them were sick. They had high blood pressure, stress levels, all of those things. And who was there 10 years ago? Who was there to tell them, look, you can change it. Look, you can reverse it. Look, it doesn't have to be this way. I had a patient that was dying. That was one of those cases that we couldn't save. And his wife asked me if she could get into the ICU and get a little bit of his hair, cut a little bit of his hair to have it as I'm sorry. I did it, I allowed it, even though I knew I could get in trouble. And I was thinking all the time, if I was with you 10 years ago, you wouldn't be here. You wouldn't be going through this situation. And I decided to transition to functional medicine, which is an approach that is more holistic, that allows the time to talk with the patients and feel what they're feeling and do the things that are best for them. Through functional medicine, I found that I can help more. Maybe not in the way that it's recognized and say, oh, you are this great doctor that prescribes this medications and do this weird procedures and all of that. It's not that. It's lifestyle medicine. It's habits medicine. It's what it used to be. When you start in medicine, they tell you this is a profession for the service of humankind. And that's kind of not happening anymore. And when I did my oath, when you graduate, you do your oath, I swear to protect and help to cure people and support them and understand them. And unfortunately, the current healthcare system that we have, the current education of medicine is not there. And that's sad. So that's why I'm here. That's why I decided to change my perspective on medicine and give more to my patients and help them. And I think there is nothing inherently bad. I don't think the modern model of medicine is bad, because if you have a acute condition or something that is really complex, that it's hard to improve only with lifestyle, that kind of intervention, it's amazing. But I would say 90% of the time with chronic conditions, those are preventable, and there is a lot that we can do before that gets to the point that it's irreversible. So I'm doing my best to do that.
Thank you. Thank you for sharing that. That's an incredible story.
You're welcome. It's great to be here sharing.
Yeah. I mean, that must have been really, really intense to go through.
It was not easy. I can tell you that. It was not easy. Losing friends, losing people that teachers of mine, attendings that were there in my medical education, and suddenly they were not there anymore. And going to the shift, and one doctor was there one week, but the next week he wasn't because he died, and he left 2 kids. And it was not easy. But that gave me the strength to say, we can prevent these things from happening, and I'll do all I can, and I'll give all I can to my patients to prevent that from happening again.
Then that's the thing, seeing people be like, I got my life back. Because even when, they're alive, but if you have various stages of chronic disease, you feel like a shell. You don't really feel very alive. To really be able to teach people how to engage with their lives in a way that is going to sustain it and support it and help them grow is very special.
Yeah, people is definitely not defined by their ailments. It's more of that, and something that as doctors, at least traditional doctors like me or mainstream doctors like me, something that we lost along the way was the capacity of have empathy and say, what you're feeling sucks and I'll help you. Because right now we don't listen, and nobody knows better how they're feeling than the patient. They live 24/7 in their body. So not me, and it doesn't matter how much training I have and how many years I spend in school or in practice, I'm never going to know how's anybody feeling. They they know. They know exactly what is happening, and when you don't listen, you miss a lot of the things that they're struggling. And a lot of times is not lack of medication, is not lack of supplements, is not lack of diet, is lack of understanding. Once they feel validated, am I correct? I'm not crazy, right? They said that and you said, yeah, you're not crazy, you're feeling that. They start improving just because of that, because the capacity of the body to heal, it's amazing. Just that validation can be medicine. And we're too focused on things that are not medicine anymore. Medicine is listening, it's being there, it's supporting, it's lending a hand when somebody needs it, not just prescribing medications or supplements or diets or whatever it is. It's that, being there. That's our role in society as doctors. So I would like to recover that in society. I would like to be an example for young doctors and other doctors that are coming behind me that there is another way to do things.
You bring tears to my eyes. I really truly hearing a doctor say like, yeah,
we fail.
But also saying that, if you're saying with listening, that is the biggest, most beautiful thing I've heard from everybody, is how much everyone's listening. You're listening to people and just listening to them and letting them talk and letting them explain the longest story ever. I know I've explained my story so many times I stopped wanting. It took me to meeting you guys to want to do it again. It's been over a decade since I've really talked to a practitioner about anything, because I was done,
Yeah.
So just having you just do that and listen and validate somebody's experience, like you said, that's so beautiful, is really where that healing begins.
Yes, it's all about healing. It's not about disease. Disease is inevitable. We have disease, we have death. We're not going to beat death by any means, but we can improve lives. We can improve quality of life. We can get people living. That's what we do.